Well, hello everyone. I'm Rem Sprague, and I have the pleasure of moderating this afternoon's presentation by Senior Resources, our area agency on aging for Muskegon, Oceana, and Ottawa counties. We have three guests today. The first is Pam Curtis. Pam is the CEO of Senior Resources, and she's been with the agency since 1990, leading the agency since 2009. During which time there's a tremendous growth in staff size, budget, and sophistication from an organization of 7 personnel and $2 million annual budget to more than 100 staff and a $26 million annual budget. Joining Pam is Amy Floria. Amy is the Community Services Director at Senior Resources. She's worked at Senior Resources for 23 years. She handles the planning function for Senior Resources and oversees programs that help older adults and their families access services, overseeing grants administration and the Medicare/Medicaid assistance programs. Also joining Pam is Cheyenne Cole. Cheyenne is the My Choice Waiver Director. She's been at the agency for 12 years. She started as a social worker for the My Choice program before becoming social work supervisor and has been director of the program for the past 5 years. Cheyenne was recently successful in leading the way toward the agency's second formal accreditation. Welcome. So Pam, what is an area agency on aging?
Well, I think, Rem, I'll give you a little background on area agencies on aging. They were really started back during President Johnson's time of service when he created the Older Americans Act. They realized that older adults were slipping through the cracks, and this is also about the time that Medicare started. Or older adults going hungry, underserved, and they wanted to fill that gap and address those needs. And so the Older Americans Act was created, and the first services that kind of came out of that were food-related services, so congregate and home-delivered meals. And then about 10 years later, in the 1970s, area agencies on aging were created. They wanted a way to get money out into communities, to get the services out into the communities. And so they wanted local, like a local presence. So they created these area agencies on aging. There are over 600 nationally. There's 16 in the state of Michigan. And then, of course, Senior Resources is the area agency on aging for Muskegon, Ottawa, and Oceana counties. So we're basically, when we started, those three counties, the commissioners wanted a regional office on aging, and they designated Senior Resources to be that agency. We are a private nonprofit. We are not part of county government, but we were their designee to provide these services. So we have over 45 years of expertise serving older adults. Our main function, we have an area planning function where we develop regional programs and services, and then we provide grant or purchase services with those funds. And we're also advocates. Advocacy can take on all kinds of faces. It's advocating to Congress at the national level, our state legislators, county commissioners, people that are in the cities, or it could be one of our social workers or nurses advocating on behalf of a client. Maybe it's with another organization, or it could be with a turnoff notice for a utility service. So it can be something grand, like the federal government, and it can be something small, just trying to help somebody out, very local. In addition to advocacy, we help people access services. We do that through our options counselors and our supports coordinators, which are traditionally RNs and social work type positions. But we don't provide any services directly. We help people access those services, but we stay neutral so that we're looking out for their best interest and not selling services that we would provide internally. So that our whole mission is a coordinated system of care. So we work with a whole network of providers to do that.
Great, thank you. Now, you got funding from the federal and state government, as well as some funding through the senior millage. What amount of funding actually flows through senior resources?
Well, this past year, despite COVID, we had about $24 million flow through senior resources. And that is a lot of money. However, 19 million of that, or about 75% of our budget, goes to the My Choice Waiver Program, which Cheyenne's going to talk about a little bit later, not in too much detail. But there's very, very specific requirements for people receiving My Choice Waiver services. And they have to qualify both medically and financially. So while our budget seems very large, a lot of it goes to some very specific needs and people. We get about $3 million, just over $3 million in state and federal dollars. And then we have about $2 million that passes through us to the local services for the Muskegon County Senior Millage. So our economic impact
So
is
about
huge.
how much of that is used for administrative?
Administrative, we're just under 7%, which is much less than the 10 to 14% that you usually see. We're pretty cost effective. And I was just going to mention the economic impact to our three counties. Most of our money goes towards services. And so that means, we're in human services. So we're providing money for a lot of jobs. A lot of that money also goes for food, home delivered meals, congregate meals, and then the purchase of goods that some of our clients might need. So that's a $24 million impact for this 3-county area. And that's pretty significant.
I would say so. Very substantial. I understand you have a new program. Can you tell us more about that?
Yes, we're very proud of this. It's just got going in July. It's an enhanced care services program. It's actually a medical service. So we've specialized in home and community-based services, for our entire being. But we realized that we needed to close a loop. We have people that are struggling in their homes. They have a hard time getting to physician appointments, meeting with their doctors, and we wanted to know what we could do to support their physicians and then also support people that maybe don't have access to a physician. And so we developed this nurse practitioner practice, and we partner with, we have a medical director, and then we also partner, if they have their own physician, we partner with that physician. But that nurse practitioner can go right into the home, work with them there, help get some of the services ordered that they need, medication changes when working with a pharmacist. There's also a community health worker in this program. We're working on a social work type position. And we have a pharmacist that can do medication reviews. So we're really trying to close that gap and reduce the amount of emergency room visits, and just really kind of level off the healthcare and the health needs for the participants that we're already serving. So we're not looking for outside referrals. We're working with the people that we already have.
Great, thank you. So Amy, how do people access services with senior resources?
So no matter how you find out about senior resources, whether it's through our website, you contact us through our main phone line, through one of our many publications or a social media site, most likely the caller is going to end up speaking with an options counselor. We have 4 dedicated options counselors who speak with people most of the day and just listen to their stories. The caller will share what the problem is or what barrier they're facing to stay in the community or the living situation of their choice. And as they share that, those options counselors are creating an option kind of map for them, whether it's community services, and we do refer a lot out into the community. There's wonderful services out there, transportation, food provision, MAP program, which is actually a program through Senior Resources, or whether it's one of our internal programs that Cheyenne's going to talk about in a minute. After the conversation is over, they share those options with the caller and have conversation and make an action plan with them. What's the next course of action and how can they possibly use that service to stay in the environment of their choice for as long as possible?
So 211 would be another source of referrals?
Oh, absolutely. Yes. We cooperate with 211 all the time. Calls go back and forth. Mhm.
Great. So Cheyenne, I understand you have a program to keep people in their homes. Do you want to tell us about that?
I do. So we actually have multiple programs available to individuals through senior resources. I'd first like to highlight that our primary goal is to prevent nursing home or transition individuals out of nursing facilities. So we have programs that will serve individuals ranging from our private pay companion care program to Medicaid funded programs such as the My Choice Waiver Program and through the senior millage of Muskegon County. So I'd like to highlight some of the specific program eligibility requirements. Individuals are generally homebound, generally demonstrate a need for assistance with daily tasks such as personal care, bathing, some homemaking duties. And then for some of our programs, there are specific financial requirements such as long-term eligibility. I do want to say that our employees at Senior Resources, options counselors, and supports coordinators assist with completing applications, obtaining verifications, and sometimes finding those and obtaining those hard to find documents, such as deeds to homes, car titles, and so on and so forth. So we also have several different services that individuals may be eligible for. Services range from home healthcare workers in the individual's own home or in an assisted living setting to medical transportation, home delivered meals, personal emergency response, the help I've fallen and can't get up buttons, to ramp modifications, ramp installations. So overall, there are 20 different service categories that an individual may be eligible for. So there's specific program requirements for all programs, but I just want to really say it's all about someone contacting an options counselor and telling us the story. So as Amy highlighted, that options counselor will start that options mapping process and make sure that the individual, the family member, the community partners, referrals can come from physicians' offices, nursing facilities, church members, whoever it may be, they'll have a clear picture of what that individual is eligible for.
Yeah, that's great. So, when people are cared for in their home, the caregivers are not necessarily the target of services. What is being done to support the caregivers?
Well, we know that without caregivers in the home providing a lot of care and a lot of support for people, many people would not be able to remain in that living situation. So it's really important that we support and train caregivers as much as possible. Senior Resources has a 40-hour per week caregiver specialist. We've increased caregiver support groups to 6 that we host throughout the region. There's more as well with those disease-specific support groups too. We have T-Care, which is an online support system that we're able to enroll caregivers in, as well as our website has a section on it for caregivers for tips and support. We can connect with local as well as national caregiver support groups. We also have trainings that we provide throughout the region specific to caregivers, specific to diseases, as well as universal caregiver issues, and then how to negate some of that burnout that caregivers sometimes find themselves suffering from.
Great. Well, thanks, Amy. So, Pam, COVID has affected everybody else. I'm sure it's had some impacts on senior resources. Can you talk about that?
Yes, I have to say I'm really proud of our organization. We did not miss a beat when COVID came and we were forced to shut down. We had made a lot of good decisions over the years on the computer equipment, the phone type of equipment that we invested in, and we were able to send everybody home working. We didn't have to lay anybody off, right down to our receptionist was answering the phones from her home and still is. We are still working from home. We have about a dozen or so staff that have voluntarily come back. They're sick of working on their dining room table, or needed that office contact, or had some issues with connectivity. And so we have a few people in, but otherwise we're all still working from home. Participants are still being cared for. So we were able to work remotely, and it has been amazing. I have to give a huge shout out to Call 211. They've been a great partner on a multitude of things for us, as well as the rest of the community. But we had started a telephone reassurance program, not knowing that that COVID was coming, but we had started it back in October, and they were the designated agency, and they have picked that up and are running with it, and have been using staff and are soon going to be training volunteers. But they also worked with us on our state office had some initiatives where they communicated out broadly, but didn't necessarily warn locally what was going on, and 211 was a great partner there. I would like to give an example around what we did with food, because we were very fortunate and to work with some new partners that we normally wouldn't have had any relationship with. We were distributing quarantine boxes, which are shelf-stable food boxes. And we're also we're doing a produce box program this summer, and neither of those were things that we've done before. And we actually still have Q boxes that we'll be doing again over the winter season. And we worked locally with the Muskegon Oceana CAP, and also Missionary for Area People. We've worked with Age Well, of course, with their home delivered meals program. We were able to help them out at the very beginning, the first few months of COVID. They had some issues with procurement of food and also capacity with staff. And we were able to tap into our national partners and kind of backfill some of the food for the homebound patient or participants, so that they can continue to get food, or to get food for people that weren't currently accessing our programs. And so just some really new areas for us that we normally don't work in. We help fund, but pretty proud of the way our staff has stepped up. Our staff even donated food for boxes that we've been distributing to people that need them as well.
It's great.
I know
I
Cheyenne.
think it's a great characteristic of Muskegon is the ability of agencies to collaborate with each other. As our time draws to a close, do you have any final comments, any of you?
I actually wanted to really focus on the social isolation concerns with our participants. So we have a new service option available, and Pam's actually going to demonstrate that for everyone. So thank you. So this is an animatronic pet, and it actually reacts to your voice and to touch, and it's they have a lifelike coat and make authentic sounds. So we have found this as a huge benefit to our participants. We have dogs and cats available, and so we thought that is just another way to really focus on our isolated participants during COVID.
Wow, what a great idea. We relied heavily on our daughter and her pet dog to keep us company for a couple months. She's gone back to DC, so maybe I can look into getting a dog from you all. I don't have to clean up after, so that'd be great. Any last comments, Pam?
I think, Rotary is great for stepping forward. I've got the cat meowing in the background, but Rotary's been very supportive of the community, and we just ask, my fellow Rotarians to look out for your neighbors and family, not just now during COVID, but as this as things continue. We are very concerned about social isolation, so checking in on older adults that are staying home because of COVID or homebound because of the weather. They appreciate contact. Any volunteering, if there's Rotarians that are interested in volunteering, we have our MAP program, which is our Medicare Medicaid Assistance Program that uses volunteers. And that's a pretty specific type of training. But if you want to know more about Medicare and want to help people with it, we're always looking for volunteers. There's the telephone reassurance program through 211, and we know AgeWell would love help with delivering home delivered meals or driving for medical appointments. So I gotta plug my network.
Great. Well, thank you all very much for a great presentation. Gained a lot of insights into a really important agency in our community. And with that, Mark, I'll give it back to you. Thanks so much.